Healthy Body by Sophie. Today we're going to be talking about stretching your neck. We have many muscles attaching from and to the neck, and as a result, let's break it down to two muscles today. We're going to talk about the Sternocleidomastoid or SCM and the Scalene muscle. There's posterior and anterior middle scalenes as well, which is deep to the sternocleidomastoid. So let's start with the SCM. So the SCM muscle, as you can see here, these muscles get engaged a lot and tightened with lots of movement up in the air where you bring your push-ups and things like that, crunches, pardon me, that's what I was looking for, sit-ups, yes. And sometimes if someone has an issue with their spine, it can be too much for them. So we need to make sure the spine is kept in a neutral position, especially in the neck. And so stretching these muscles can be very helpful. As you can see here, this is my sternocleidomastoid. That's one of the head. The other head is right behind it, right here. So this is the sternocleidomastoid head that's in the front, and that attaches to the sternum right here. And it goes to the mastoid process behind the ear. Then you have another head that's behind the sternocleidomastoid head. That usually is the one that pops out on people, and behind it, and that one attaches to the clavicles. This is your clavicle here, and still it attaches up here in your mastoid process. So there are referral pattern with that. Which means that you may experience pain varying from different degree or discomfort, wrapping all the way around to you behind your ear. So with the sternal head of the sternocleidomastoid, basically that will go and wrap around all behind your head and then go above your eye and all even down into your facial muscles. That it's gonna seem that you're having an issue there, but it often can come from that sternocleidomastoid sternal head. As far as the head that attaches to the clavicle, it will go into your ear, behind your ear, and then 2 points above your eye of that side. So obviously it's bilateral, meaning both sides. You have them on both sides. So here I'm just showing you this side. It's the easiest side to show you. Then the process would be the same for the other side. Then to stretch this muscle, you need to basically go to the opposite side in a lateral flexion. So you're bringing, if I'm stretching my left side of my sternocleidomastoid, I'm going to turn my head to the right as I'm stretching the left. So right ear to right shoulder, and then you add bringing your head up, looking up at the ceiling with your eye. Don't want to jar your head too far back, especially if you do have a neck issue. This will stretch your sternocleidomastoid. Keep in mind, drop your shoulders down so that your cervical spines, your spine and your cervicals are not being jarred and squeezed, the discs. And that will help to prevent any issue with your cervicals and your discs. So this is a movement to stretch your both head of your sternocleidomastoid on the left side, while you're doing this movement with my ears toward my right side, and a slight upward movement with my chin, just looking up at the ceiling with my eye. All right, so we talked about the stretch of this muscle this way. Now to get the other head that is behind the sternal head and get to the clavicle head, you're basically going to turn your head in rotation to the same side, so to your left if I'm working the left side, and you could have a little bit of an upward movement, but really this is enough. As I am turning my head to the left, focusing on my left sternocleidomastoid here at the clavicular head. As I'm doing this, it's gonna stretch in here because it actually is tightening my right sternocleidomastoid. So it's doing the opposite on the side I'm working, the stretch to the left. So that would be for your clavicular head. Now we're going to talk about doing ice and stretch of that muscle. It's basically doing the same thing of these two exercises that I mainly how to stretch one side. So you'll have in one of the stretch you'll have to turn your head to the opposite direction in a lateral flexion or side bending to the opposite side. The other one is just rotation towards that side, so chin toward that same shoulder, and then you can lift your head a little bit. Obviously, if you go to a therapist, they would be doing the technique for you, but if you want to do that self-stretching at home, make sure you are sitting in a sturdy, comfortable position on a stool or chair, and then you drop your shoulders down. I do that always because it allows my cervicals not to get jarred, otherwise it can cause some issue if you have some disc issue. So I'm gonna go grab an ice cube, and then we're gonna do 3 passes for the sternocleidomastoid at the sternal head, and then same at the clavicular head, doing the same stretch I just did, and then you basically will repeat that to the other side. So with the assistance of my helper, being my husband, thank you very much. Here I have 2 Dixie little cups here, and they've been filled with ice. So we're gonna I'm gonna just grab one for now, and I'm gonna bring my towel with me because in the past you could use and that is unfortunately very dangerous. I might have butchered the name, but I'm sure Wayne will pop it up somewhere on the screen to correct my saying of it. That is not good for the environment. It's aerosol, and the product itself, the chemical itself, basically just brings cold air to the area, and it's very effective. Well, it was very effective and still is. However, it should not be used anymore because it's very bad for the environment and for the planet. So instead we can use ice. And so you could use a smaller towel. This is a big hand towel, big bath towel, I guess you could call it. I'm going to use this side, even though it still has a little bit of the Dixie cup here inside. I'm going to use this side because it's smaller than this side, and I want to make 3 passes, so hopefully you can see me. I'm going to actually grab a hand towel. It will be a face cloth here. The face cloth being smaller makes it easier for you to see what I'm doing. So I'm going to use my opposite hand so that you can see, otherwise I'll be in the way. It will be in the way. And I'm going, so as I am working my left sternocleidomastoid at the sternal head, I'm gonna turn my head to the right, and I'm gonna bring my head up. So here, now I'm gonna put my ice cube right on it, and then I'm gonna go up to behind my ear. Now if I did have any pain or referral pattern as far as this particular stretch going into my head, I would keep going with the ice cube and go on my forehead, even on my face, if it was referring any pain or really tightness that I wanted to relieve. I'm not gonna do that. I'm just going here for my purpose here, and actually it does feel nice. Now so you do 1 pass, pardon me, I did 2 passes. You do 1 pass, and you have to warm up the tissue, because if you don't warm up the tissue, basically using the ice is to trick the muscle to relax. Actually, I already can feel the difference just from doing that. So you can warm up the tissue with just the warmth of your hand, or if you have something to warm up your hand, a little hand warmer or heating pad. Just for a few moments you can just go in that same motion right here from here in the center of your below your décolleté, below your neck, and then go up behind the ear. Alrighty, so now that it's warmed up, I'm gonna stretch this again. So I'm gonna do side bending to the right as I'm stretching the left, and I'm gonna lift my head up to stretch the muscle, dropping my shoulders down, watching my posture as well, and pulling my belly in. Why? Well, because we want to keep good posture, and as we are putting more stress on the neck, then it put more pressure onto the rest of our body to give us support. So we need to keep strong and at the same time relaxed everywhere. So now that I've stretched, I'm putting a little bit of a drag here by stabilizing here, because I have lots of fascia restrictions still, and so I definitely can feel even other structures engaging, but today we'll stay focused on your sternocleidomastoid and scalene coming up. Alright, so now you just stretch that. You could feel a little other sensation, like your throat tightening, things like that. We're not going to go there right now. Again, this is usually linked to fascia restrictions and other muscles being involved into the tightness. Alrighty, so now I stretched it, I warmed it after using ice once. I'm going to put it back into that position. So side bending or lateral flexion to the opposite side, bringing my opposite ear to the opposite shoulder, and slight looking up. You don't really have to move your head much. Actually, I can feel it in my ear right now, and it feels things want to drain. So so just looking with your head, with your eyes up to the ceiling is actually sufficient. Especially if you have compromised neck or vertebrae, that's all I would do if I were you. Okay, now from here I'm gonna get my point here where the sternocleidomastoid starts at the clavicular head. My piece here is now wanting to fall of a Dixie cup, and I'm gonna go up behind. Try and pick not exactly the same spot, just next to it, 3 stripes in 3 different spots. Because we have to dry that water. So just one time like this. Now I'm going to warm up that again. And you can see it's getting all red in here. And if you're someone who feels tightness through here for different reason, doing this actually could be very helpful. So let's warm that up back up. Dry it all up. Dry it up. Okay, and we're going to do one more time. So again, side bending to the right, looking up toward the ceiling with my eyes, and very minute slight upward movement with my neck, and then I'm going a little bit further back, but still in that same movement. So if you have something thinner that you could, little stick of ice, ice sticks, like to make ice cubes, you can get the little sticks. That might be better because this is a bit wide, so that you're not, you really can mix 3 different lines. I mean, it's really tricky to do that. The muscle is only this big, right? So big, but there we go. You get the idea. So now I'm gonna warm that up. We did that 3 times, and now I'm gonna do the same thing to the clavicular attachment, where I'm gonna turn toward my left side and move up this way, and then go right in here. So right above my clavicle here, I'm on the clavicle basically. So that's that piece of bone here, the clavicle, and then up toward the ear. So here you're gonna want to use probably the same side, because you have to go in that position. Okay, dry it off because it's dripping. Warm it up. And repeat. So I'm going to use the same hand. Find your clavicle. Turn your head that way, your chin, and slight looking up. Put your ice cube right in the corner above the clavicle, and move the ice cube up behind your ear on that bony prominence you can feel behind your ear. Alrighty, so we did that. So that was a stretch. Then you repeat the stretch with the ice. You warm it up. You repeat the stretch. You use the ice, and you repeat that cycle 3 times, and then you will do the same thing to the other side. Okay? So you get the idea. Now, because the ice obviously made this all wet, wet and red. Now, I'm going to demonstrate the SCM. No, we did the SCM. Now I am going to demonstrate the scalene muscle. And so for the scalene muscle, basically, to stretch that muscle, you just do a side bending to the opposite side. So actually, while I was working on the left sternocleidomastoid, I was stretching my scalene, which is deep, very deep, behind the sternocleidomastoid. And that can be the entrapment. That muscle can be key to issues with numbness, tingling going down the arm, even down into the chest. So if, for example, one had a scalene super tight on the left side, they might think they could be possibly having a heart attack, when really, obviously, you have to rule that out if you did experience that. Once you rule out any heart-related issue, most likely it's the scalene that's entrapped and causing the brachial plexus to be compromised, and as a result, you're getting those shooting or pain, tingling down into your arm, or even all the way into the wrist. And again, pain down into the chest. So let's treat that, and that can also contribute to a lot of other things. So here I'm going to stretch my scalene muscle, going to the opposite side. So you might know how to do this one with, you put your hand above your head. So here I would put my left hand above my head to stretch to the right, keeping my shoulders nice and level. So if you have a mirror in front of you, have that to make sure your shoulders are not going like this. You're nice and horizontal with the shoulders if you had an horizontal line, and you assist. One thing you could do if you're just stretching and not doing the ice stretch yet, you put your hand underneath the stool or chair you're sitting on. That's why sitting is good as opposed to doing it standing. Standing is fine as long as you keep all of your alignments, hips and shoulders. But here, holding on underneath the stool makes it that you will less likely lift your shoulder up, and you turn your head, well, not turning your head, what you do, but in a side bending motion, lateral flexion we call it, where my left ear is going to the left shoulder, and I'm stretching my, so now I'm stretching my right scalene. Okay, so I'm gonna go back to neutral, I'm gonna stretch here, and I'm gonna put the ice cube, which is melting as soon as it's making contact with my warm skin, and there we go, I'm gonna go up in that motion. Okay, and so for stretching the scalene muscle, you're gonna take your head to your left as I'm stretching the right side. I'm gonna put my ice right above the clavicle here and behind that muscle here. That's my sternocleidomastoid that we worked on the other side. So you're gonna go behind it basically, and you're gonna stretch your head to the opposite side. Now with this pattern, if you're feeling any pain or any issue, numbing, tingling going down the arm, you're basically going to follow that pattern with the ice and go down to your arm. It could be really any of those areas. So you go one line. Also, it goes behind your back. So for the scalene, unfortunately, if you're by yourself, it might be tricky unless you have super long arm, which I don't, and reaching the back. You can get a little bit, I suppose. But every time, after one pass, you need to warm up the tissue. dry it off with the towel or another towel, and nice and dry, and then you just massage with your arm the area. If you have a nice a heat pack or something like that, you can use that, or a nice dry warm towel to warm it up. That would be sufficient. Like here, since I'm doing a larger surface, I have more ice and water as a result on my arm. And so there, now it may go as well down into your chest, as we were talking about. If it mimics heart attack on the left side, well, you can get that as well on the right side if your scalene is tight. So you basically, again, take your left hand, if you're working the right scalene, turn to lateral flexion to the left. Try not to do this with your shoulder and your body. Keep nice and straight to get straight, to really get the stretch. You can even leave your arm down below here if you need the stability. And then you're gonna go down. If you feel there's tightness in there, you're getting pain, and then you go in, you know, you could do a couple of passes, but then after that you have to warm that up. And you can even use a towel that will help to warm it up. Plus movement of your body will help to warm it up. So really this sums it up. The scalene, basically it attaches to your first rib and to the second rib as well. And then it goes deep into the neck, and it touches your transverse processes of your cervicals. So it goes deep in the center of the neck, you know, the midline. And what I wanted to add about the scalene being the entrapper is that because of its location so deep in the tissues, it can, if tied to the point where you possibly, it will compresses the brachial plexus, and especially your auxiliary artery that goes in your underarm. So auxiliary artery, and as well your ulnar nerve. So that's why you might be experiencing some pain going down the arm and into your wrist. So keep that in mind. If you do experience any chest issue, left or right, or specifically the left, go to your doctor, rule out any issue with that, see what they have to say. Once they've cleared any cardiovascular issue, then you would be able to go seek help to a therapist and do this self-care stretch in your home. Ice, generally speaking, is good and cooling, so if you're feeling hot anyhow, that's a good thing to use to cool down your neck. Your wrist as well is very helpful to cool down when you're hot, because then from your wrist, basically, your blood through the vein is gonna only go back to the heart, and therefore it's gonna cool down the quickest way your essential organs, your heart and your brain. Alrighty, so I hope you enjoyed this exercise. If you have any questions or comments below, there's lots more to talk about, but we're gonna keep it condensed and short to these two muscles and these couple of exercises. There's more to come in the future. Hope you enjoyed this, and I will see you on another episode of Healthy Body by Sophie. Until next time, thank you so much for joining me, and you have a wonderful rest of your day. Namaste.
Working a 9 to 5, I had to go and feed the guys. Nobody did it right, I had to show them how to grind. I had to beat the odds, this is the life I live for God. Taking a step at a time, we going up, we headed to Mars. Taking them chances, making decisions, you know I'm never gonna lie. Till you let go, I'm copying all of who you gon' be inside. I cannot fake it, I gotta face it, I gotta do the time.